Hello everyone, I am Health Manager Ava. In clinical practice, I have encountered many male patients who, after getting married, find that their sexual performance is far from what they expected, often characterized by short duration and weak erection. I usually ask them a question. When you were younger, did you have a habit of frequent masturbation? The answer is often yes. During treatment, I typically ask them to stop masturbation, but I do not explicitly require them to completely abstain from marital sexual activity. This leads many people to ask. Masturbation also involves ejaculation, and marital sex also involves ejaculation. So why is masturbation considered harmful, while marital sex seems less so? From certain traditional medical perspectives, these two are not exactly the same. Today, I will explain the differences between masturbation and sexual intercourse from a traditional Chinese medicine, TCM, viewpoint. I also hope that the men present, as well as parents who have teenage sons, will take this seriously. If you find this meaningful after watching, you can leave the word useful in the comments section. First of all, the difference between masturbation and sexual intercourse goes far beyond ejaculation itself. Masturbation is often accompanied by sexual fantasies and exposure to pornographic content, and the conditions for indulgence are almost unrestricted. Some individuals even develop fantasies involving extreme, unrealistic, or ethically inappropriate scenarios. For example, one patient mentioned that although he was relatively young, he had long been addicted to unrealistic sexual fantasies and gradually developed low self-esteem. This situation is not uncommon among individuals who frequently masturbate alongside compulsive sexual fantasy. Physical weakness can often be improved with proper care, but psychological effects may gradually erode a person's confidence, making them feel inferior in many aspects of life. Such psychological impacts often require a long time to recover from. In addition, this process can also be seen as a form of self-discipline struggle against desire. Those who are able to persist in restraint often undergo noticeable personal transformation. From a behavioral perspective, masturbation is highly accessible and requires no partner. It can occur anytime and anywhere in private settings such as at home or in dormitories, as long as the thought arises. This lack of external constraint can easily lead to habitual or addictive behavior. At the same time, prolonged exposure to sexual stimuli may also lead to distraction and reduced concentration. In contrast, marital sexual activity is a mutual behavior involving both partners and is connected to emotional interaction. From certain traditional medical viewpoints, it is believed to involve a different dynamic of yin and yang interaction compared to solitary release. From a traditional Chinese medicine perspective, the 5 internal organs are closely related to mental and spiritual functions. The liver stores the soul, the lungs store the corporeal spirit, the heart houses the mind, the kidneys store essence, and the spleen governs intention. It is believed that masturbation and sexual intercourse involve these organs in different ways. In some interpretations, masturbation is more associated with imagination and mental stimulation, which may strongly activate heart fire and liver-kidney fire, potentially leading to emotional and mental instability. As a result, some individuals may experience reduced concentration, fatigue, and weakened willpower. Long-term behavior of this kind is also believed to contribute to dysfunction of the spleen and stomach, accumulation of dampness, and general fatigue, conditions often described in TCM as imbalances of qi and blood. Furthermore, some individuals may experience a variety of physical symptoms such as hair loss, fatigue, dull complexion, lower back and knee weakness, poor concentration, sleep disturbances, and other related issues. In this framework, such symptoms are often attributed to kidney deficiency or depletion of vital essence. It should be noted that these explanations come primarily from traditional medical theory, and different medical systems may interpret these phenomena differently. Overall, there is a view that each ejaculation represents a certain level of bodily consumption, and therefore moderation and preservation of vital essence are emphasized. A common belief is that abundant essence leads to strong vitality and good health. It is also argued that excessive repetitive behavior may negatively affect one's physical condition, mental state, and overall energy levels, especially when there is a lack of self-control. In conclusion, While masturbation and sexual intercourse both involve ejaculation, they differ in psychological involvement, behavioral patterns, and social context. Therefore, it is important to understand their differences correctly, avoid excessive indulgence, and maintain a healthier and more balanced lifestyle. At the same time, fostering stable and healthy intimate relationships may help improve both emotional and physical well-being. That is today's discussion. I hope everyone approaches this topic without prejudice and does not feel ashamed to discuss related issues when they arise. Learning more and understanding more can help you better adjust your lifestyle and protect your health. I am Health Manager Ava.
See you next time.